Hi, we're at ViVe and we have an amazing guest. Please tell us who you are and what you do.
Name is Anil Saldanha. I'm the Chief Innovation Officer for Rush, a University System for Health. We are a 3.5 billion health system out of Chicago, and I basically lead innovation for Rush. Yeah.
Tell us what it's like to be an innovation officer during the AI age at the health system. Is it like you get 1,500 pitches every minute? Like, hey, use our solution or do a pilot with us.
It's a complicated answer, to be honest. Like, when you look at it, I think we are at a critical juncture in healthcare. We've had all these advances, AI being one of them, but also as an industry, we have progressed. From a long time ago, there's a lot more digital that has come into healthcare, not just on I would say clinical care, but also therapeutics and other places, research, education. So digital, the whole concept of digital is kind of ingrained in healthcare. When you think of healthcare, traditionally it's always been like doctors and nurses and patients, right? Everything else was just a companion, but now digital is very important. So over time, when you look at think of AI has been influenced healthcare for a long time. Machine learning and models and stuff like that, and particularly things like computer vision. And I've been part of med tech and devices and diagnostics and areas like that. In the last few years, of course, with generative AI, when all the buzz that's created, of course, it's a new dimension to the whole AI landscape, and I think that's what's exciting. In terms of companies or startups and solutions being pitched, I think every employee at Rush experiences that, and everybody is open to new things, novel ideas. Some of us get pitched a lot more than others, but it's a great time to be in healthcare.
We'll get to AI in a second, but interesting to hear from you. What are the red flags for you when you talk to a founder who tried to pitch us his solution or her solution to you? What are the red flags? And they're like, oh, this is not going to work for sure. And this right away.
So typically, there's a few factors that define a good startup, for example, right? And this is something repeat founders have kind of mastered. So they have kind of learned all the challenges, and things like half of the time it's sales and how you present your solutions, you talk about that. But also you start looking at a company when it's building or offering something. It's like, what problem are they trying to solve, right? Unless there is a problem that that is being met by the solution that this company is offering, there's no point in having a conversation, right? If not, a lot of the companies you see today are just saying, oh, we are AI, this, AI, that. And from a healthcare perspective, we are looking to solve problems, and it's your solution solving the problem. So that's the first metric that people use when they're looking at companies. But also, I would say how matured is the founder in their description of the problem they're solving. If they're matured in building the company and have done enough due diligence, because on the health system side, there's very limited time to engage a company and do a pilot, for example, because it's very it's kind of costly in terms of people's time, and also regulations and patients' lives. So it's a tough industry for innovation in many ways. And so as a startup or as a founder, it makes sense for you to have enough advisors on your whatever, on your board, or around you, to explain to you that you should put in as much diligence as possible into your company and cover all areas that a health system might find, something lacking, like things like information security compliance, right? Any regulatory restrictions, defining the problem, and there's a lot of things, but startup founders can, do the diligence, and when they come to a health system, if they are matured, much easier to do a pilot, and pilot to production, it becomes easier. Yeah.
You mentioned that obviously you as a health system, you need resources to do a pilot with a startup. How many pilots can you do at the same time with different startups?
I would say a few. It's not like hundreds or,
Right.
but it's a few. Like again, it's not a question of how many, to be honest. It's like there is a problem that you're trying to solve at the enterprise level, or it's probably in one specialty or it might be on the research side. And as you know, health systems and academic medical centers are doing research all the time, and they're piloting stuff because it's in the context of research. So you have opportunities to fail. It might be some study, and so you have opportunities to showcase that, look, the study has been successful. In terms of studies, you can have as many pilots as you can, right? But if it's not like a research study, but it's more like operational, then I would say the appetite for multiple pilots is lower, but you can do a few pilots. Again, it depends, like, what's your intersection? Is it across the enterprise, or is it in a particular area? Of course, a finance, HR, and non-clinical side, those are separate, like separate.
Kind of to wrap up this section, what percentage of startup founders gets into the pilot, and what percentage of startups actually starts adopting the solution at the health system after the pilot?
I would say it's 50-50.
Oh, wow.
Yeah, it depends on the health system. Like,
That's after the pilot?
yeah, I mean, like, typically I would say, let's say we engage a pilot, which means we have identified a problem to be solved, and our diligence process would ensure that, the pilot, like, by the time you come in, your mileage is much better, like, and then it's just filling the gaps, and I would say it's more, but if there is a system that just like, hey, let's do a pilot without actually providing the advisory, structure, and it's also on the health system to provide the necessary support. Yeah, so I would say the diligence process that health system goes through to engage a startup should be thorough, which also means you have to provide some kind of hand-holding and advisory, mechanism. So it's not like we're just doing a pilot for the sake of doing a pilot. Yeah. So I would say more than 50% can go into production. Yeah.
Okay, well, that's interesting. I assume if the percentage is lower for other health systems, they didn't do their due diligence really well.
It depends, and I can't comment on all the health systems, but typically if you're driven by, okay, this is a problem to solve, and sometimes you have an area that like a competitors are trying out, for example, in the region, and then like they might tell you that, hey, look at this, we are engaged in this, and so it's also depends on like where the startup came from. Yeah.
Gen AI and agentic AI, any specific use cases you're mostly excited about in healthcare?
So I think the agentic, when you look at it's called the front door, as you know, right? There is a front door for any of the services like a health system. So it's critical, right? It's dependent on access to care. And previously, like, you had these contact centers where people could call in, but a system such as Rush or App cannot actually field all the calls. So you need help in terms of AI, some Gen AI, LLM-based solution or agentic solution, which are maturing. So I would say access to care, the access center is where things are going to, because that's the window into your health system, basically. Yeah.
Cool. The last question for today, you've probably walked around the different booths. Anything surprised you here at ViVe that you're like, oh, there's a lot of ambient listening, for example, or something that's
No, I think it's matured. Like for example, like last year it was probably more towards ambient, but this time it's more towards AI in general. But also you're seeing, okay, they're talking about care coordination and not just ambient. They moved away from and there's a little more of clinical AI, So I think it's just time and it's maturity of some of these AI companies. Yeah, and also ambient is kind of relatively solved. Right. So what are the other areas that AI can be helpful? Yeah.
that means we're moving in the right direction.
Exactly. Yeah.
Awesome. Thank you so much.
Thank you.